2011 ONS conference in Boston, Massachusetts. Oncology.TV is delighted to have with us Dr. Jane Armour from the University of Missouri School of Nursing. Thanks for stopping by.
It's my pleasure. Thank you for the opportunity.
So you've been taking a look at what oncology nurses may not know about cancer-related lymphedema. What have you found?
Well, we feel that there's a lack of understanding about what is possible in the management of lymphedema. Nurses often do the risk reduction education for side effects of treatment. We also know that there is a specialized management of lymphedema. That training is available to nurses as well as other health professionals. Physical therapists, occupational therapists, massage therapists, and nurses are the professions that are usually trained in this specialization. Oncology nurses may not be aware that that opportunity is there and that those are the specialized professionals that should manage the treatment of lymphedema and the advanced training that's done for patients in self-management. The training involves 135 hours of classroom and hands-on training. A year of practice then allows that therapist, the lymphedema therapist, to sit for a voluntary certification by the Lymphology Association of North America. That is the standard that we'd like to see patients, cancer patients who are at risk and who have developed lymphedema, to be seen by a specialized lymphedema therapist for the care that can be provided for the best lifelong management.
This is an area which is or should be close to the hearts of oncology nurses.
That's right. Nurses, by their nature, are often the managers of symptoms for patients. They're often the one that the patient is comfortable talking to about discomfort they may have after their treatment. They may not bring it up to their physician because they are grateful that they're still alive and they don't want to be complainers, but the nurse is often able to elicit the symptom experience for the patient and help them to manage those symptoms. Lymphedema may affect 40% of breast cancer survivors. Even a higher percentage of other cancer survivors may be affected by lymphedema. So a nurse is really on the front line in being able to refer the patient for further assessment and to be able to help them to manage those symptoms.
Now you have even bigger plans for this work in the near future. Can you share the details with us?
We do. I'm the director of the American Lymphedema Framework Project, which is housed at the University of Missouri. We've done a survey in 2009 to assess a baseline of what training and what modalities are used in the management of lymphedema across the country. We plan to repeat this survey in November of 2011 to see what has changed in the last 2 years. Our goal with the ALFP is to increase awareness, to support education and research in lymphedema, but overall to improve care for patients with lymphedema. The majority of those patients with lymphedema are actually cancer survivors. That's the largest cause of secondary lymphedema in our country and in the world. So it's very close to the heart of cancer nurses and physicians caring for patients. We also have made a proposal for funding to conduct a summit in late 2011 or early 2012 to look at the training standards for the management of lymphedema, to bring together all the professions that manage lymphedema and to come to some agreement about those standards in order to improve care for patients. We hope to be able to make an announcement about that later in the summer.
Dr. Armour, thanks for stopping by and sharing your work.
It's my pleasure. Thank you for the opportunity.
Dr. Jane Armour from the University of Missouri School of Nursing, joining us here on Oncology.TV at the 2011 ONS conference.